Good afternoon. And today we have a pleasure of interviewing somebody so important for our health, Dr. Nathan Bryan. Good afternoon, doctor.
Thank you, Maria. It's great to be with you. Thanks for having me.
And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this program is for you. We're going to talk about healthy supplement or the molecule that we have in our body, but some of us don't have it no more, called nitric oxide. That molecule what got the discovery of that molecule got the Nobel Prize in 1998. And if you're a medical professional and you're looking to put puzzles of that very dangerous disease called sleep apnea together, this program is for you because we're going to address it from unique standpoint called nitric oxide production. And now I'm going to share, story about Dr. Nathan Bryan. I'm sure a lot of people in my audience know him because he's an author of the book Functional Nitric Oxide Nutrition. And as you know, I love to connect nutrition and health, and I interview, Michael Moss and Mario Nessel on my channel. So I want that component to be part of the health assessments. And a lot of my friends actually, talk about Dr. Bryan, and they were so excited. But now I have a guest, and now I can ask all these messages, all these questions, so they send it to you. So he devoted his life to this molecule called nitric oxide. And just like my friend said, any questions, any scientific publication, Dr. Bryan would know about that. Anything about nitric oxide, you know it by heart. And my first question to you would be, tell me, what exactly nitric oxide and why is that so important for our body?
Well, thanks. Look, it's a great question. It's a fundamental question, but really nitric oxide is a signaling molecule. It's a gas that's naturally produced in the lining of the blood vessels. It's produced in the cells of the brain and the central nervous system. It's produced by our immune cells to kill off invading pathogens. But it's how cells in the body communicate. It's most widely known for its ability to signal the smooth muscle around the blood vessels to relax and dilate. So it controls oxygen delivery, tissue oxygenation. It controls insulin signaling. And we discovered in 2007 that it's actually a hormone. So it controls cell signaling within the human body. And the older we get, the less we make. And that's what leads to the onset and progression of most, if not all, age-related chronic disease.
That sounds scary and exciting at the same time. So tell me your story with nitric oxide, how you personally become interested in that molecules. Is it Nobel Prize, has any role in your story?
Yeah, I got a degree in biochemistry from the University of Texas at Austin. And then after that, I was a student at LSU School of Medicine in Shreveport. And this was the late 90s, early 2000s. And as you mentioned, the Nobel Prize had just been awarded for the discovery of nitric oxide. And, my first year at LSU School of Medicine, we had Lou Ignarro, one of the gentlemen who shared the Nobel Prize for the discovery of nitric oxide, come to Louisiana and give a lecture before the student body. And I learned a lot from him, and I had a chance to have dinner with him that night and ask a lot of questions as kind of a naive first-year student, and was really, encouraged about this, what we called a miracle molecule at the time, because it was a gas that was naturally produced. It did so many things, but at the time, even by the admission of Dr. Ignarro, we really didn't understand all the pathways, how the human body made nitric oxide. We really didn't understand what led to a deficiency of nitric oxide. And we were just then getting to get a feel for what symptoms would manifest as a result of losing the ability to produce nitric oxide. And then certainly at that time, there were no product technologies, no drug therapy that were effective, safe and effective at restoring the production of nitric oxide and preventing the age-related loss of nitric oxide. So to me, it was like the great blue ocean. There was so many unanswered questions. We knew it was an important molecule. And so I just devoted the rest of my adult career and professional life to trying to understand those unanswered questions. How does the human body make nitric oxide? What goes wrong in people that can't make it? And then how do we restore it?
That's a beautiful, and I put the big blue ocean, on my background to kind of illustrate your words. But what important for me, what I learned from you actually on collaboration cure, what nitric oxide can be produced in the mouth. Yes. Tell me a little bit about that. How does it happen?
Well, the first pathway to be discovered was through an enzyme in the lining of the blood vessel. We call this nitric oxide synthase. And that enzyme converts arginine into nitric oxide. But about 25 years ago, it was discovered that there are bacteria that live on the crypts of the tongue, on the dorsal part of the tongue. And part of their metabolic machinery is to help the body produce nitric oxide gas. And so these are what we call nitrate reducers. They're facultative anaerobic bacteria, and they take nitrate from the diet, either from green leafy vegetables or the nitric oxide that's produced in our body. And then it recycles this nitrate. So it's a 2-electron reduction from nitrate to nitrite. And then we swallow our own saliva into the acid lumen of the stomach. We produce nitric oxide gas. So it's part of this fundamental physiological pathway for endogenous nitric oxide production to compensate for the loss of the endothelial nitric oxide. And so it's a compensatory redundant mechanism to maintain adequate nitric oxide production. But that's where the problems arise. So if you don't have the right bacteria, if you have oral dysbiosis, if you use mouthwash, then we're starting to learn that it eradicates nitric oxide, disrupts nitric oxide production, and leads to symptoms of nitric oxide deficiency.
That's a fascinating thing, and we're all concerned with the aging. Not aging is bad, but whatever comes with the aging, that's really bad. And I talk a lot on my channel. What kind of strike me so much, what I deal with people who come with a bouquet. So bouquet is the following: high blood pressure, periodontal disease, acid reflux, asthma. They all related. We can talk about diabetes and atrial fibrillation. And I'm wondering, did you discover what connect this bouquet? What is actually the bow on a bouquet?
Well, all of those are conditions of nitric oxide deficiency. Once we figured out that these bacteria are essential for producing nitric oxide, now we have to figure out how do we support and improve the diversity of the microbiome and not destroy it. 2 out of 3 Americans have an unsafe elevation in blood pressure. And not coincidentally, 2 out of 3 Americans wake up every morning and use an antiseptic mouthwash. And now we're finding that that's responsible. So we and others have published that, if you take normal intensive patients and you just give them mouthwash for 7 days, you don't change your diet, these are unmedicated people, we see their blood pressure go up. And then additional studies have shown that if you use mouthwash, you actually lose the protective benefits of exercise. And then, so mouthwash is bad. Fluoride is an antiseptic as well. And then, antacids, which disrupt stomach acid production, basically disrupts this pathway as well. So all of those on people who have high blood pressure, people who have on antacids and proton pump inhibitors, all of these collateral symptoms that develop after they start these processes can be related to a loss of nitric oxide production. And that's just kind of the early onset of symptoms. And if not corrected, it leads to chronic disease, cardiovascular disease, heart attack, stroke, Alzheimer's, diabetes, metabolic disease. So the list is growing.
That's scary. But tell me, you put, in all your paper, what nitric oxide start declining in 20s. And, is that related to the mouthwash, or there are other factors what relate to that decline?
Well, what we're finding in the published literature tell us that this age-related decline in nitric oxide production is due to the function of the nitric oxide synthase in the lining of the blood vessel. And so we call this endothelial dysfunction. And so there are many things that contribute to that. It's poor diet, it's a Western diet, it's a lifestyle, use of antacids, which lead to an increase in a compound called asymmetric dimethyl L-arginine, or ADMA. We get oxidative stress. It oxidizes BH4 to BH2, NOS uncoupling, and we become nitric oxide deficient. So that age-related decline in nitric oxide production is by the function of the enzyme. So we can compensate for that. Number one, we can recouple that enzyme, so we now know how to restore normal endothelial function. But we have to maintain some backup production of nitric oxide, and that's the role of the oral bacteria. So there's not an age-related decline in the function of the oral bacteria. It's mostly related to oral hygienic practices. So those that use mouthwash, then you can see a deficiency of nitric oxide really early on. And even in people who start taking antacids early on, they start to develop symptoms of nitric oxide deficiency. So these two independent pathways, the loss of endothelial function with age, and then the loss of nitric oxide production by the oral bacteria, are two separate independent mechanisms that are affected and regulated differently.
Yeah, that's a fascinating story because mouthwash is like, everybody use mouthwash. Not everybody, but it's, I guess, the state, how public is informed about mouthwash should change, just like Western diet, which both contribute to decrease of nitric oxide production. But now I would like to ask you about two of your creation. My first question would be about the supplements. If you can show to my audience what people can do to increase nitric oxide production. And by the way, I was on your site and I saw those beautiful, care products, and I really want them all.
Yeah. Well, no, look, we created a way. So about 15 or 20 years ago, we discovered these mechanisms of nitric oxide production in the human body, and then what goes wrong in people that can't make it. So once we understood the mechanism of disease, now to the extent that we can correct that. So nitric oxide is a gas, and you can't deliver nitric oxide in a capsule, in a gummy, or a chew. And so what we had to do is we had to think a little bit differently. And this is an orally disintegrating tablet. And you just put it in your mouth, and you just let it dissolve. You don't chew it, you don't swallow it. But as this lozenge is dissolving, we're actually producing nitric oxide gas. We can detect it, we can quantify it. So it's similar to hormone replacement therapy. If your body can't make estrogen, we give you estrogen. If your body can't make testosterone, we give you testosterone. We don't give you precursors and hope your body can make testosterone or estrogen out of it. We give you the actual molecule. And that's what we do. We produce nitric oxide gas. This is the only solid dose form of nitric oxide gas in the world. I'm the only person who's ever solved that riddle and developed that. So it does three things. Number one, if your body can't make nitric oxide, we're doing it for you. These products are generating it for you. But because it's an orally disintegrating tablet, what we're finding is that the pathogenic bacteria, the gingival bacteria, the caries-causing bacteria, are sensitive to nitric oxide. So we're killing the bad guys, and we're helping support the diversity of the microbiome. So now we're actually enhancing the body's ability to make nitric oxide through the oral cavity by the oral microbiome. And then we have data to show that within 4 hours of taking this lozenge, we've improved endothelial production of nitric oxide by about 15%. So we're improving the body's ability to make nitric oxide on its own, which as a physiologist, that's my objective. Give the body what it needs, let the body do its job.
That's great. It's now the question from my friend Talia. She said, if you want to improve certain performance, let's say sexual performance, what's the schedule? How far in advance you have to take that lotion, the tablet, to see the effect? Or before the physical exercise or whatever?
No, it's immediate. As soon as you put the lozenge in your mouth, we can detect nitric oxide gas. And if we put an ultrasound on the carotid, we can see dilation of the blood vessels within a matter of seconds. And then, within 20 minutes, we start to see if you have an elevation in blood pressure, we can start to see the blood pressure become more normal. So we're supporting healthy blood pressure. But in terms of improving athletic performance or sexual performance, you can take it immediately. Immediate onset, even during exercise, during a marathon, or during intimacy or sexual activity, because intercourse and sexual function is dependent upon dilation of the blood vessels of the sex organs. So if those blood vessels can't make nitric oxide, you don't get engorgement and we don't get vasodilation. And that is erectile dysfunction in both men and women. So if we can produce nitric oxide and dilate the blood vessels, you're going to improve erection. You're going to increase the volume and the pressure in the labia and the clitoris of women, and they're going to become more orgasmic, and it's going to enhance sexual function in both men and women.
That's the magic pill. Tell me about the skincare products, what I also noticed on your website, which I think for both female and male population is so important to use?
Yeah, so this is a really innovative, unique product. It's a dual chamber. We got 2 compartments here. When you mix these 2 together, they generate nitric oxide gas. And I'll just do a quick demo here. But you take 1 pump from one side, 1 pump from the other, and then you mix it together. And then you can apply it to the skin. But what it's doing when you mix these together, it starts to produce nitric oxide gas. And you can see on the top of the hand, you'll see the blood vessels start to dilate. It'll turn pink wherever we've applied it. So we're improving blood flow to wherever you apply this. And what we're finding in our clinical trials, it improves collagen deposition, it mobilizes stem cells, and so it improves hydration, fine lines and wrinkles improve. It's great for, we've got studies going on now for wound care, for acne. But this is a topical nitric oxide. In fact, it's the only topical nitric oxide product on the market, and it's a fantastic product. It's a new category in skincare and beauty, and this is a game changer in aesthetics and really non-surgical facelifts.
I cannot wait to start using that. That looks so promising. So people can use it actually before the intercourse.
Well, you can apply it wherever you want to increase blood flow. I tell people, our clinical studies reveal that it gets the wrinkles out. So you can use your imagination.
Okay. So it's a great, tip, or one of the tools in armamentarium. I would put it this way. So please tell us about your book. I want to talk about nitric oxide and nutrition. How people can actually, use the food to increase the production.
Yeah, well, the book Functional Nitric Oxide Nutrition I published 7 or 8 years ago. But yeah, it talks about, the plant-based diet, a Mediterranean-based diet, a Japanese-based diet. The cardioprotective benefits of that can be explained mechanistically. The mechanism of action of all those diets is through the contents of inorganic nitrate in those dietary patterns, which the bacteria can reduce to nitric oxide and normalize nitric oxide levels. But all that's dependent upon the oral microbiome and stomach acid production. So if you're eating a plant-based diet, but you're using mouthwash, you're completely eliminating the benefits of that. So yeah, I think it's what we're finding is that it's a balanced diet in moderation. Throw in some more green leafy vegetables, get rid of your mouthwash, your fluoride, and your toothpaste, wean off your antacids, and now the body's actually primed to produce nitric oxide on its own. And we can activate it and stimulate it through moderate physical exercise, 20, 30 minutes of sunlight a day, and then, just throwing in some more green leafy vegetables. So the science is very complicated and complex, but what we're finding is the solutions are pretty simple.
No, that's like you mimicking the nature, or,
Exactly.
adding what nature can give you. I want to ask on the behalf of my patients who come with a bouquet. So tell me, people who already experience cardiovascular problem, can your supplement be instead of blood pressure medication?
Well,
how quickly?
Yeah, our objective is to, and what we call these concepts of restorative physiology. So, most drug companies and pharmaceutical companies employ pharmacology. They give you a synthetic compound that inhibits a biochemical reaction, like the angiotensin converting enzyme, what we call an ACE inhibitor for blood pressure. So there are always consequences that if you inhibit a biochemical reaction. So what we do is completely different. It's called restorative physiology. We replete missing molecules in the body. So we're never giving the body a foreign substance. So when we do that, what we're finding is that you can start to get people off prescription medication, because 50% of the people that are prescribed antihypertensive medications don't respond with better blood pressure. And yet you go back to your doctor, they put you on more medicines. So what we try to do is understand the root cause of their underlying issues. And if it's high blood pressure, that's simple. It's typically an insufficient production of nitric oxide. So if we can restore and replete nitric oxide production and nitric oxide signaling and get people off mouthwash, fluoride, and acids, then normally their blood pressure will normalize. And then there's no need for prescription medication. So to answer your question, if we give the body what it needs and remove from the body what it doesn't need, the body heals itself. And in that model, there's no need for prescription medication. So the answer is yes.
Yeah, so that's very, very promising, hopeful. But tell our audience, number one, I didn't ask you in the beginning, what education you got in the medical school? You have a MD degree or PhD degree? I want you to tell us to tell us about, you know.
Yeah, no, I got a PhD in molecular and cellular physiology at LSU School of Medicine. So everything we were doing was geared towards understanding human disease and trying to understand the mechanism of disease so that we could develop safe and effective therapeutics, diagnostics, or medical devices. So that was my training, a bachelor's degree in biochemistry, a PhD in molecular and cellular physiology. And then I did a 3-year postdoc in cardiovascular medicine and vascular biology.
And another question also for my audience, what organs produce nitric oxide? I constantly talk to people about the nose. Now, with your lecture, what I heard on collaboration cure, I'm going to talk about mouth. We just talk about bacteria. And of course, we know about sexual organs, but what other organs produce nitric oxide? Or how this mechanism, if you can explain the whole production mechanism.
Well, every organ in the body produces nitric oxide because every organ's function depends upon the blood supply. And so the endothelium is the largest organ in the body. So the endothelial cells control and regulate circulation and blood flow to every organ in the body. But, for instance, in the liver, we've got Kupffer cells that produce nitric oxide, hepatocytes produce nitric oxide. In the brain, we've got astrocytes that produce it, neurons produce it. So even in myocytes in the heart actually produce it. So every organ system, every tissue, every cell in the body has the ability to produce nitric oxide because it's part of the cell signaling cascade that kind of allows for these metabolic processes, regulation of blood flow and circulation, getting the nutrients and oxygen in, taking out the metabolic waste product. But yeah, you can also deliver it in the nose and the nasal sinuses through nasal breathing. People who are mouth breathers bypass this nitric oxide production pathway, and it leads to a lot of systemic problems.
That's interesting. And now, question what I've been waiting to ask you. Tell me, how do you think nitric oxide supplementation fit into broader conversation for anti-aging therapy?
Well, look, there's no doubt today the science reveals this, that nitric oxide is the holy grail in anti-aging. Because when we look at what are the objective measures of longevity and anti-aging, and it's really the mobilization of stem cells, it's the length of our telomeres, and it's the function of our mitochondria. And nitric oxide is what controls and regulates all that. Nitric oxide is the signal that tells our own stem cells to mobilize and differentiate, to repair and replace dysfunctional cells. Nitric oxide activates the telomerase enzyme, prevents telomeres from shorting, so from getting shorter. And we know that if you can prevent telomere shortening, you can prevent early death, and longer telomeres, longer lifespan. And then every major chronic disease is associated with lower numbers of mitochondria per cell and dysfunctional mitochondria. And nitric oxide induces mitochondrial biogenesis. It recouples the electron transport chain of the mitochondria and improves energy production through an efficiency of oxygen utilization to produce more ATP. So everything we know about longevity and anti-aging medicine is dependent upon the cell's ability to produce nitric oxide. So if your body can't make nitric oxide, you're going to get an early onset and progression of disease. You're going to have early death. If we can maintain adequate production of nitric oxide, then by all measures, we can prolong life, prolong our health span, and hopefully live a long life free of disease. That's my goal, at least. I don't think we're immortal beings, but I do certainly believe that we can live, long past 100 years old, free of disease, and still, have a good, healthy lifespan and enjoy the life that we live.
So basically, what's the magic formula? People have to take one lozenge of nitric oxide a day, or how many?
Everybody's different. For me, what I developed this as kind of a once daily. And I've been taking this for probably 20 years now. And I take it because not because I need it, it's because I don't want to need it. Right. So typically what I do, and I'm 50 years old, but I take one lozenge in the morning, and then I usually work out in the afternoons. I may take another lozenge in the afternoon or one before bed. But what we're finding kind of as a prophylactic, kind of preventative measure, if you will, I think one lozenge twice a day seems to be sufficient. But if you're older, or whether you're older or younger, but you're already got some health challenges, whether you're metabolically unfit, high blood pressure, diabetes, then you may need one lozenge every 6-8 hours, one lozenge every 4 hours for really resistant high blood pressure and things like that. But we leave it to the best medical judgment of the physician or the practitioner to figure out what's best for that particular patient.
Got it. So this particular lozenge can prevent Alzheimer's?
Well, these are dietary supplements, obviously not intended to prevent, cure, or treat any disease. But I will tell you, we have a drug company called Bryan Therapeutics where we're developing this same lozenge into a drug therapy specifically for Alzheimer's. And I'm very confident that nitric oxide is the cure for Alzheimer's, because all hallmarks of Alzheimer's, if you see in Alzheimer's patients, they have reduced blood flow to the brain, and they get protein misfolding, and they develop insulin resistance in the brain. We call it diabetes type 3. Nitric oxide dilates the blood vessels, improves cerebral blood flow, prevents protein misfolding, and potentiates insulin signaling and allows for glucose to get into the cell. So if you address the root cause of dementia and Alzheimer's, which is what nitric oxide is and does, then you don't get protein misfolding, you don't start to develop mild cognitive disorders, and you don't get insulin resistance and impairment in glucose uptake in the brain. And under those conditions, you don't develop Alzheimer's. But I think that the trick for us is to find the right patient population, and best case scenario, we can reverse disease. But what I clearly think, and we have confidence in some human data today, that if we catch this disease early on, we can certainly prevent the progression and even regress it. But I think there comes a point in every disease process where there's a point of no return. We just have to catch these patients early on when they have mild cognitive disorders, early vascular dementia, and then start the therapy and then prevent the onset and progression of Alzheimer's.
Thank you very much. We really appreciate your time, Dr. Bryan. And I recommend to my audience, find Dr. Bryan website and read about important qualities of nitric oxide. I highly recommend the book, Functional Nitric Oxide Nutrition, and the products, nitric oxide in the shape of anti-wrinkle cream and lozenge to improve all possible functions, very important functions in our body. So thank you very much, doctor.
Thank you very much. Pleasure being with you.